Uh, Good afternoon, everyone. I'm sorry that's taken me a bit longer than was expected. New piece of software, and I thought I had it set up rightly, but I didn't. But anyway, getting on with the topic today, GPs and the lies they tell us. I can tell you for a very long time that before I was put on diamorphine, GPs kept telling me that it was illegal for a GP to actually give diamorphine to a patient, which I found out afterwards through the GP that was very kindly, as part of my discussion both with myself, a cardiologist, and also an anaesthetist, and all three of them agreed that diamorphine was my best option. Now, when I was first put on diamorphine, I will tell you straight, I fought against it. I actually went 6 months in severe pain, refusing to go on it because of the nature of what it is. I'm fully aware that diamorphine is a very, very strong opiate. Possibly one of the strongest opiates on the market. It is the German name for heroin. So there it is, straightforward. I'm not covering anything up, I'm not lying about anything. You can do the checking yourself. Diamorphine originates from Germany and is actually heroin. It's the purest form of heroin you can get in this country. Yes, in the wrong hands it is dangerous, but in the right hands and being used by the right people, it can be used to help comfort and help people live a day-to-day life. Let me give you an example of this. Up until July of last year, I had one walking stick. I was able to move around reasonably easy. Yes, I still had niggly pains, but compared to what I'm receiving now, it's nothing. I was able to live. And what doctors forget is we don't want to survive. We don't want to just be as such. We want more to life than that. I want to go out and I want to enjoy myself. I want to go out with friends. I want to meet new friends. I want to stop being a hermit in my own home. Because on bad days, I'm just not able to sleep. But doctors don't seem to understand that, and they have a tendency of playing what I call the God card. Is, well, I've done 7 years worth of training, so therefore I know better than you. Actually, I know my body far better than you do. I know my body from the tip of my head to the very bottoms of my toe. I know exact every twinge that it goes through, every time I pull a muscle, every time my spine starts playing up, every time I start getting severe pain. I know exactly what's going on. I am fully aware of what's going on, and I know what's best for me. Now it's about time doctors stopped thinking that they know what's best for me and taking notice and saying, actually, maybe the patients do know. Maybe the patients do understand their bodies. They're the ones that have to live with it 24/7. I'm the one that's lived with it for 24/7 for nearly 25 years. And I can tell you now, there is no doctor out there that knows my body better than I do, because they don't bother reading the medical notes. Even my GP admitted yesterday, after I went to see her, she hasn't read through my medical notes. And yet she's still refusing point blank to prescribe the medication that works for me. How about you start getting you medical professionals get your head out of your arses and actually start taking notice of us people. Now, there was another thing that came up yesterday. While I was at Little Street Surgery, and yes, I am mentioning the surgery because I will be making sure that each surgery that I've been with over the last few months will be mentioned personally, and that they will be known for the fact that they failed a patient and failed many more patients that are willing to stay quiet. But I can guarantee you there are patients in every surgery in this country that need to either start standing up and saying enough is enough, or maybe even if you don't feel the strength to do that, get in contact with me. Now, I do apologise in the area that this broadcast is going into. It's going into science and technology. I was hoping that there was going to be a place in medical, but there is actually no area in the medical area. There's actually no area called medical. So therefore I've had to go through for the best choice possible. So just give me a second while I have a drink. Oh, that's better. Now, I will always be straightforward with you. If you send me the information about your conditions, I will keep them private, but I can't guarantee that I will agree with your synopsis of them. I will look at everyone individually and I will decide who I can support and how I can back them in any way possible, whether that be through letter writing, contacting your local MPs, contacting your local health authority. I am now going to be the voice for the people who will not be listened to. So if you want a voice and you want to have it heard loud, then please contact me, because I am willing to fight for you. I am willing to see that pain in this country is dealt with properly. A lot of our hospitals, they have big notices up saying pain should be dealt with, pain should be controlled. Well, I can tell you, you hospitals, Manor Hospital, City Hospital, you are failing. And I can guarantee you that list of hospitals is going to grow even longer and faster. Because for every hospital that has failed a patient, I will make sure that it is named on this podcast and that as many people will get to hear these podcasts as possible. Now, I know that I am not a social person, so it's going to take time to build up a following. But I ask anybody that does listen that they take time and think about what I've said today. Do you feel that you can get behind this? Do you feel that you've had medical conditions in the past where the medical professions haven't listened to you? And I'm not just talking about pain, I'm talking about other things in your life. Whether it be mental issues, which we are struggling with in this country at the moment, or whether it be physical issues, which are just not being taken seriously. Or even maybe you can tell me of people that you know, and I'm sorry to be so blunt, but of people that you know who possibly have died because they were misdiagnosed and not listened to when they kept going to their doctor complaining about pain, about uncomfortableness, about not feeling well, or about absolutely anything. that you feel is absolutely necessary. I know that this is hard. I understand it is hard. What I am doing today is setting a new fire under the NHS. Yes, Brexit is coming up, and it does mean that we may have a shortages of medications. But holding on to them, which I'm fully aware is going on, because the main hospital informed me last time I was in that all their morphine supplies are being kept in-house specifically for the use of just the anaesthetic department. It's no longer being allowed to be used across the hospital, and that was told to me by a doctor. And I think that's wrong. When they have supplies, and they now do have enough morphine supplies back in the country, it's taken time, and there have been other problems with opiate supplies. There have been problems with different types of tablets like morphine sulfate, Severodol, 20 milligrams. There was a 2-week period where they couldn't be got hold of. And I believe that there was a problem with fentanyl for a period of time. And there have been many problems of shortages of other drugs. I will get a list of these drugs so you are aware that I'm not just a pain management person, that I'm not just interested in looking after myself, but I'm interested in looking after the health of the British Isles, because I am fed up with doctors believing that they are gods when they are nothing but practitioners of medication, very well trained and have a great understanding of many things, but there are still a lot of things you do not understand, and that is the reason why you are called practicing. Not completed, not finished. So let me make you aware that I will call out any practitioner who thinks he knows better. There are a lot of patients that do a research by themselves. You doctors might not like it, it's tough. I will tell you the reason why I started to do my own research. It was because while I was in hospital once, I was on Ramapril, 2.5 milligrams, and there was a doctor in the hospital that wrote me up for 25 milligrams of Ramapril. Now, if I'd taken that, it would have killed me. The nurses prepped it, got it all ready, and it was only because I asked what it was that I managed to stop taking it. So I could have been dead through your idea of practices. And I'm fed up of being your guinea pig, and now it's your time to be our guinea pigs. You will hear us, and you will hear us loudly. I promise. Yes, I promise that I will fight to the very dying of my day. I promise that you have heard my voice, and I promise that I am coming for you. For all those people that are watching this, I don't mean this to be an angry program. I don't mean this to be an attack on the medical profession. There are many doctors out there that are great. They do their jobs on a daily basis, and they work hard, and they do good for their patients. And I would say to those doctors, great. But some of you doctors even know that there are some of your colleagues that don't listen to patients, and I would encourage you strongly to start advising them by you asking him to listen to you, so that they will start taking this seriously. That sometimes patients do know what is best. And remember, this is a partnership, or it's supposed to be a partnership, and yet you doctors have let the partnership down. You speak down to us, you speak across us, you speak through us, you do not listen, and that is not acceptable. That really, really is not acceptable. A consultation should be a conversation where you listen and I listen, and then a plan is brought together by both parties, not by one party who says, well, this is what's going to happen, because that's what you GPs do, and that's what you consultants do. Really listen to the patient. If something works for a patient, why take them off them? Yes, some of you may be running scared because of the government's propaganda on opiates. But as a voice, we can stand up against the government and say, no, we are not willing to accept this, both as patients and as doctors. Do not let anyone push you around. I am aware that opiates are an issue at the moment in the press, in the public eye, in the way they've been perceived. But they do have benefits that far outweigh a lot of other things. And there are many other drugs. For instance, I have just been put back on Zopiclone, which is another dependent drug depending on how it's used. But the GP surgery I went to, Little London Street Surgery, the first 3 doctors that I spoke to would not give them to me, even though they were prescribed by a psychiatrist who had prescribed them to me for one reason only, was because my pain wasn't in control, and so therefore she thought that sleep would be helpful. And yet, a GP surgery, in their ultimate wisdom, felt that they could not supply them, or would not supply them. It was, according to them, it was against their policies, until I went to see a particular doctor, which I'm not going to name because it could get her into trouble. But I thank that particular doctor for the fact that she has given me the sleeping tablets, which meant that I had a good night's sleep last night, which meant that I had enough power to get up and go out for about 20 to 30 minutes today, which I haven't done for a few weeks, and where I was able to get my hair cut and actually have some enjoyment. I had a nice cup of coffee at Costa, and sorry, just a second. And it gave me a bit of release. Now that doesn't mean to say that the sleeping tablets helped my pain, but it gave my body enough time to recover, to give me enough strength to fight with the pain. And it is amazing what one good night's sleep does. And I know that there are many out there that are in pain, that their doctors are refusing to give them anything for sleep. And sometimes we go 2 to 3 weeks without sleep. And it gets pretty boring watching the same programs over and over again. I have watched every American soap, every American program and every Sky program you can think of, and now I'm repeating myself only because of the fact that I don't sleep. That gives you a little insight into me, and I'm sorry if I've gone a bit on a bit about me today, but I feel that for you to understand what I'm fighting for, you have to understand that I'm in this fight with you. I'm not an advocate. I'm just a voice that's saying enough is enough. But I want to bring you all in. I want to bring you all in to stand with me and say enough is enough as well. So let's build this, and let's build it from strength to strength. I'm going to try my hardest to do at least one weekly podcast over all the information that I can gather on different situations related to the NHS and their use of medication. And no, it won't always be about pain relief unless so many people contact me that they would like me to talk about more pain management, more different types of medications, which some of them I will research and look into. And I'm asking you to give me time. And I would like to help support people as much as I can. So I am signing off for now. I thank you for your time, and I thank you for listening to me. Good evening, and speak to you soon.